Here again today. We are going to be doing, of course, a little bit more lips, but also she is in the middle of prep. She's, what, how many weeks out now?
9.
9 weeks out. So we have a little plan because as she depletes, the face starts getting a little bit more what she calls her skeleton face, or
yeah, diet face.
her diet face. So it's too soon to do any filler at this point because she will be trimming down a lot more at this point. So what we're gonna do today is just do a little fresh up of Botox. Actually today, because she is an athlete and I have seen that with athletes, Dysport tends to last them a little bit longer. We're gonna try, it's gonna be her first time doing Dysport. And then we'll see here in the next 4 weeks how she likes that. But we're gonna do Dysport and then we're gonna do PRP, so a little bit of platelet-rich plasma. We're just gonna go around the eye area, trying to maximize volume and at the same time get the texture of the skin a little bit tighter. So I'm gonna use two different techniques. There will be a little bit of downtime today because the filler technique that I will be using is going completely down into the muscle area, but then also nappage technique, which is more superficial to create more collagen and elastin fibers. But that one can always have a little bit of bruising. Also because of how many times we end up pricking the skin, we would definitely want her to stay clean and make sure that she doesn't sweat. So of course, no working out today. And so she gets a day off. You're actually gonna be able to see the volumization of the PRP. And this is a cool technique to also use with patients that are scared of doing filler because the PRP will get absorbed by the skin. So by me doing PRP, she will get to see what it would potentially look like with filler. So some patients that don't wanna take that leap of faith yet, PRP is a good option. So here we go. Deep breath. What we'll do today is just treat one side so you can see the difference. Your PRP looks lovely.
Yay.
I need to do my PRP also. It's been a while. Honestly, that's like my cheat sheet. Every 6 months, I tend to do my PRP like this. To not have to do so much filler.
How often do you usually do filler?
Once a year. If not, I try to push it every 14 months. But obviously, I don't deplete as much as you, like doing back and forth.
Man, prep does a number on your face.
Look up for me real quick. Okay, relax.
I can even, it feels more lifted.
Mm-hmm. Are you gonna be able to see it right now when we show you the mirror? It's cool to inject her because she's so vascular that I can actually see every single area. So definitely no bruising here. You're making my job easy. Okay, so look at the difference between one side to the other. And
this is like saggy bulldog face. Oh. Yeah.
And then with these here, what I'm gonna do, okay, so now we replaced the volume that she was lacking. Now when she smiles, we see the little ones there. So that's where I'm gonna do the nappage technique.
Wow. I have cheeks again.
Mm-hmm. So we'll actually do the filler about 4 to 3 weeks out from her show. Here goes the nappage technique. Okay. Obviously, you're going to see the little bumps here, which will go away here in the next, but see how we filled that out.
Oh, yeah.
So that will take about kind of a couple of days to start making the effects, 2 weeks to see the end result.
Very cool.
2 years?
Oh, yeah, probably about 2 years now.
Yeah. So,
which is crazy because, you know, like, old pictures will pop up as memories, and I'm like, dang, like, I noticed a huge difference. I've been meaning to, like, do, like, a side-by-side.
absolutely. Yeah, that'd be a good idea.
Differences.
Well, because I was just thinking about it, and honestly, like, your face has sustained its laxity, everything looks good, but you just look so much more fresh, if that makes sense.
I completely agree.
There's another girl, she's very pretty, but her before and after compared to what she looks like now, it's like, wow.
That's why, like, I was talking to Misty, and she's like, I don't want to do Botox too soon. And I'm just like, no, like, you don't understand. Like, it's like, you'll be better off starting it early than if you're going to wait and, like, you have all these, like wrinkles and, like, fine lines.
And then you can tell they got something done. And after the eye starts drooping and all that, you can't assist that. Like, you can make it happen, but then it's going to look fake, right?
Yeah, yeah.
So right now you guys just saw me inject a little bit of plasma into her temple. A lot of people, as we get older, we actually lose volume here. What we kind of call the peanut head. So you literally start noticing these areas on the temples to atrophy. And so what we do is just inject a little bit of PRP in hopes that it regenerates that tissue and keeps it healthy for longer. But it's really amazing that after like 2 years of injecting you and you also doing your part and not sleeping on your face has kind of like found its symmetry. Do you know what I'm saying?
Yeah.
Let me look at that temple right there. Pay attention. I'm gonna go ahead and actually put some PRP there. You can see a little bit of the volume loss on this side. So let's play with that a little bit. Oh, sorry, kicking your lamp. Right here. If you guys pay attention to this area where I just put 1 little cc of PRP, and then here, see how much she's flatter on this side versus this side. So.
You really have to have a good eye to do this.
Definitely. And in her case, it's very minimal, but a little bit goes a long way. So right now I literally injected 0.3, and look at the difference that made. So, can y'all see that? Can you pick up on that? So the beauty of this is that all of this is preventative. We only did 0.3 of PRP. This is gonna keep her body sustaining her own volume, her own elasticity, versus waiting until you're in your mid-40s, 50s, and then you have to get PRP, Botox, fillers. So with her sustaining with PRP every 6 months, and then doing filler maybe once every, depending on her depletion phases, but yes, once a year, it should be sufficient to keep her long term from having to ever get a facelift or anything like that. Okay. Let me take a look. Do you see that?
Yeah, I do see it. All of it. Wow.
So today, because I treated you with PRP, I can't inject this area with Botox, but I know that you're coming regularly to see the guys. So just whenever you come in, after you finish, just let me know and I'll pop in to real quick do your Botox. But today we'll do this and not do this just because there's so much fluid from the PRP.
Okay.
Okay.
Cool. It's crazy how immediate you can see like a change.
Now we're doing nappage. I have a lot of people tell me, I want to look like Renee. Like,
You're like, well, I'm not a plastic surgeon.
I can't do that, hun. Like, yeah, she's very pretty. And I was like, I can't do that.
We're hilarious.
You had acne, didn't you?
Yeah, I had some like
Mild.
I never had like really bad acne as a teenager, but when I did get it, like I got some like really bad.
Yeah.
You know,
More on this side than this side. Do you remember?
I don't remember.
It's been too long.
I know I have some little like scars and stuff from it.
Since we already have you on the table, do you mind if I do like a demonstration of scar removal?
Oh yeah, of course.
It's for effects, dramatic effects, okay? I'm kidding.
People get excited to see blood.
They really do, honestly. The more blood they see, the better. No kidding. Okay, so today with Miss Renee, she is near perfection, but we do have a little bit of acne scarring from long ago here in this area. Since it's very hard to get her on my table, just because she's so active, we are gonna take advantage a little bit of her being here. And so I'm gonna use a technique that we introduced at Canula and just kind of break down that scar tissue that has happened to the acne scarring. And that should, once again, create more collagen and elastin. And then I will deposit a little bit of PRP. So here we go. Yeah, get close up. So. At first you'll notice I'm not going to deposit any product. All I'm doing is look at my cannula in the bevel and I can literally feel the breaking of that scar. Can you feel that, Renee?
I can hear it more than
Hear them?
feel it.
Yeah, good. Yeah, I really wouldn't want her to feel it, but she says she feels it. But you guys can actually see how it's blocking my cannula. Now, I just feel a couple more right here, but actually as you break those scars through, you can actually see how much more with ease my cannula is going in. That will feel a little tender the next couple of days, which is normal. And I'm going to deposit a little bit of PRP. Okay. Cool, right? You okay?
Yeah.
You can actually hear that.
Yeah, I can hear it for sure.
Let's see how much smoother it is now. Like on the fourth pass.
Yeah.
Like right here, there's still some scarring.
Was the other side worse than this side?
Mm-hmm. There we go. See, there's a couple little scars there. Turn your face this way, Renee. You guys are gonna see how popping through those. There we go. And that's it. And now just put some of this PRP in there for the healing properties. And for texturizing the skin. Perfection.
Lip gloss.
pouty lips. This point right here is to give her a little bit of highlight. That way the light shines on it and gives her that perfect profile, especially for her selfies. Now kiss, smile, relax, smile again, relax, and do this face. I don't know what to say. Make sure that we get that right there. Relax. We're just doing enough Botox in this area to relax that contraction for, once again, preventative. That way she doesn't get the dimpling as older women tend to get. But also, if you notice in her face, this side is a little bit larger than this side here. And it's because this muscle is developing due to her facial features and expressions that she does. So I went ahead and did a little bit of neurotoxin here to help that muscle relax. And then a tiny bit here for a little bit of the lip flip. The only thing that comes with that is that she won't be able to spit. And drinking out of straws will be a little interesting.
I'm not even gonna attempt that.
And then bunny nose, relax. I do put a little bit of Botox or neurotoxin on the nose area just to relax these bunny lines, but at the same time, for oil production, I go a little bit on her nose as well. Okay, squeeze, relax. She's one of those people that her corrugator does move, so you do want to address this little point there. Change my needle so I don't torture her too much. Raise your eyebrows, relax. And we are done.